Good afternoon, everybody. My name is Matt Gross. I head up the Health and Life Science Global Practice at SAS. This afternoon, I wanted to talk to you a little bit about big data and how it's being used in the health and life sciences areas. I'd like to talk about this in three perspectives. First, just what are some of the emerging trends, some of the things that are happening either because of or as a result of big data. The second is how these trends and how big data is impacting the way businesses are working and how they're organizing themselves. And last, I wanted to talk a little bit about a couple case studies, some examples of big data and how it's being used in healthcare and in life sciences. Before I start, though, big data is a term that everybody seems to use, but no one seems to agree to as to what it means. And different companies and different people will have different definitions and perspectives. Whatever big data is, it's whatever it means to that company. The way we refer to it is big data is when the amount of information or how quickly you need a response or that you have a lot of different types of data is more than your company can handle. Now, when you're looking at big data, one of the things to think about is big data might just mean a lot of data. And a lot of data doesn't necessarily mean that that's a good thing for you. And actually, what most companies are challenged with is how to get through the big data to the relevant data, the important data, the information that will allow you as a company to make the right decision at the right time. There's also one other V. You see on this screen volume, variety, and velocity as the three V's that most people talk about for big data. And the value of getting to the right data is the fourth V. You'll also hear me talk about today what we call veracity, the fifth V, which is the trustworthiness or the information that you can believe in from the big data that you're collecting. So what are some of the trends that we're seeing in healthcare and life sciences? The first one around big data is the interest and the inclusion of unstructured data or free-form text. And this text may come from free-form fields in electronic medical records. It might come from social media and public websites. It can also be transcripts of calls or conversations that are going on. But there's large amounts of data that were never included before in analyses that are now being integrated into companies for them to make decisions. The second component is the interest in data that's actually out there and defined and developed because of real-world experiences. And this is oftentimes reported, for instance, in electronic medical records when doctors are interviewing patients, or sometimes self-reported, whether formally as part of an electronic health record, or whether informally as people start to post more and more information on social media sites, on websites around the world, with the intention of either sharing their experiences or learning from one another. And the fact that this data is available either in a formal way by integrating with a health company or an informal way, such as looking throughout the information publicly available on the web, that there's great opportunity to take this information and learn from it, and even to form what analyses and what interactions research companies should investigate based on history, based on what people have already experienced and presented. The third aspect that's really gaining traction in big data is the fact that big data means it's very difficult to understand what the true insights are within it. As a member of my team once said, nowadays people should start to use the analysis that comes just by using their own intelligence. The human brain is very good at picking up patterns with just seeing things in a visual way. So by turning data into a visual experience, as opposed to one that's more numbers and tables and figures and listings, it allows new people to get involved with the information, to identify areas of interest and opportunity, and to start to get to the right question that they want their statisticians or their data scientists to take a look at. The fourth trend that we're seeing really comes from this concept of what I call veracity. When nobody trusts data that they themselves have not collected or they know what the source is, yet most of the new data being brought into the system for analysis is information that was collected outside the realm of the company that's analyzing it. Especially in healthcare, where information might be collected from social sites, might be reported by patients, the information that's coming in is certainly not of the high quality that the data that you would have collected within your own organization would have gone through. So with the inclusion of many new types of information, and often information that's outside your own control, there's new analyses that are being done to make sure that the information that you're looking at is not only of high quality, but is trustworthy and is something that you're confident in, that you want to include in your analysis. And this is a whole new emerging area within analytics, especially within big data. The fifth area is in the challenge that comes with the more data you have and the more complex the analysis you do, the more time it takes for you to come to insights. And if it's going to take hours or days or weeks to find out an answer to something, then that answer may come too late for you to act. There's a whole new structure that's taking place within organizations, whether internal to their organization or whether they're doing it outside through analytics as a service in the cloud, for instance. To do high performance analytics, to make sure that you can quickly and sometimes in near real time analyze large amounts of information so that you can make business decisions quickly and perhaps review and analyze several different approaches to come to the right answer. So how is this impacting businesses? Well, the first challenge that they're facing is to access all this new data. How do you go and get information, whether from the web, or how do you integrate with a medical system to collect their electronic medical records or their health information? Also, the information that's coming in from new sensors, whether a lot of times people are wearing devices, whether they're Fitbits, which is a very popular one, or other medical wearable devices. These sensor data are constantly collecting information, and how do you bring it into an environment where you can analyze it in the way that you want to do it? The second is how do you integrate all this disparate data? One of the biggest challenges with data management is in integrating information from multiple places. Master data management, identifying the same human being, whether it's a patient or a provider, across many multiple disparate data sources. Or sometimes how to identify an individual who's anonymous because they posted something on the web, but yet you need to know if this is the same person that referenced another posting someplace else. So oftentimes companies are challenged with integrating information both within their organization, but then to integrate it with information collected outside their organization. The third challenge is with managing big data. Most companies just don't have the infrastructure to handle the massive amounts of data that are being collected. So how do you change the way, and how do you gain access to both the storage capacity as well as the analytic capacity to bring this data together, to store it, to analyze it, and to make it available to the right people at the right time, and only in the information that they need to have access to. The fourth concept then is to get to the right data. And as you're going through the massive amounts of information, how do you filter out the information that is incorrect, that is invalid, that is inappropriate from the data analysis that you want to do? So there's a lot of analytics that go from weaning down the large volume of data to the right data that you're interested in, and to make sure that it is of the quality that you want to do your analysis. And finally, companies are trying to figure out how to make this information accessible and to analyze it so that it can be included as part of the business strategy, as part of the business planning and decision-making process. Oftentimes, analyses were done by people in the basement running large programs that would take hours or days to run. Nowadays, it's about streaming analytics. It's about bringing the analysis to the data. It's about performing analytics in memory so that you can analyze large amounts of information and slice it and dice it as in real time as you need it, and then making this information available in a way that's consumable by people who don't know necessarily all that there is to know about statistics or analytics, but who are really just looking for the results. So what companies have been doing is developing really an enterprise analytics framework, and a way of looking at analysis as just part and parcel of the infrastructure of a company's architecture, as opposed to a business challenge. So they're looking at, since all of these needs, all of the analysis, whether it's from the medical group, whether it's from the marketing group, whether it's from the financial group, all have the same challenges. There's the challenges of information management, the challenge of bringing data from unknown external sources and internal sources, and conforming that to the standards by which that company needs them to be, to clean that data, to get it into an analytically ready data set for others to do. That process is repeatable across all different parts of the organization. So how do you have an information management part within your organization that takes that information and makes it available in an enterprise analytics environment where all people, whether they are your own employees, whether you're the partners, whether they are regulatory agencies reviewing your information, can get secure access to either the data for analysis or to the results of that data so that they can use it to make their decisions. Within that enterprise analytics environment, there's also the need for companies to develop their own analytic modules or to incorporate others that can fit and access the information as part of the enterprise analytics environment so that workflow can automate some of the analysis that takes place and can do some of the advanced models that most companies are looking at doing. So the idea is that this environment needs to be extensible. It needs to be able to add on new models, new types of data, new information without changing the platform. And finally, the last part is analytics are interesting, and the insights are only useful if they can be presented in a way that's meaningful to the consumer. And sometimes when you're dealing with an executive, that they need something that's very simple for them to understand, yet they can drill down so they can understand what drove that result, that they can look at it in a slightly different way, and that they can then quickly feed back to you as the developer of these analysis so that you can go back and find the root cause or find some more information about some insight that was revealed to them. So the visualization not only of the data, but the visualization and the information dissemination of the results so that this information can get to the right person at the right time in real time is a very important aspect of the analytic framework. So now I wanted to talk about three use cases, three case studies that we've done, that SAS has been involved with several organizations across both health and life sciences, and actually as part of the regulatory industry as well. The first comes from the healthcare sector. This is something out of the Nordic region. There's a hospital system, Lillebælt Hospital, who has a large number of patient records, a large number of electronic medical records, sometimes called journals. And the challenge was, when reviewing these, there were a lot of errors that were not being found within the information. And the challenge here was how to automate this process, how to be able to go through large amounts of unstructured data to help improve the quality and the care of the patients that were going through this hospital system. So what they looked at doing was using text analytics. Look at the free-form comments, the free-form fields that were within these journals. And they were looking for several things. They're looking to understand, were there events that were not reported or underreported? And also, were there differences in what was being captured in the structured part of the form, the electronic medical record, and what was being captured in the notes, in the unstructured? There were obviously a lot of errors, a lot of challenges and information that was not being accurately reflected. And the system, by using text analytics and by looking at the information, was able to identify a large number of underreported medical events, and also to help them identify what the trigger conditions were for those avoidable medical events. In essence, what they're able to do is to build almost a case management system where they can identify a certain type of avoidable situation, identify what was causing that, and then to put in a corrective action plan to prevent those, which would reduce the cost to the hospital system, improve the quality, and improve the patient safety for those patients attending that hospital. Also, because they were able to improve the quality of the data that were in these medical records, the doctors and the providers that were looking at this information could feel more confident that the information they were looking at was the actual right information that reflected that patient's conditions. Another area of great interest, especially in the idea of big data, is in the area of genomics. Now, the goal of genomics, as is with most aspects of healthcare, is to make this data actionable, to look at the information that, whether it's looking at the genomic information or other healthcare information, and to make that part of the healthcare decision-making process. Now, with genomics, you have additional capabilities, especially around things like tailored therapeutics, where you're looking at specific medications, specific drugs to help with specific conditions. But it's also about helping the caretaker, helping the provider, or those that are managing the patient's health, to make the right decision based upon analysis of people like that individual, or like the combination of that individual with their condition. It also helps in the personalized care, where it really is about understanding who that individual is, their makeup, and what the most likely outcome would be for someone given different treatments. It helps the patient also become an informed consumer, because now they can look at a variety of options and add their own personal preference as to what they prefer to do, and not just what might be the proposed best treatment. And finally, in genomics, an area of growing interest that we're seeing at SAS is not just in the health and life sciences area, but also what's called the crop sciences or plant sciences, which is looking at genomics and how to change the way the agronomics or the agriculture business is looking at creating new seeds, looking at how to help farmers get the greatest yield based upon their conditions of the dirt and the soil, the weather conditions, and comparing that to the right treatment or the right seed, the right crop to grow for that particular area. So genomics is a big interest in a much larger space than just in health and life sciences. So the case study I wanted to highlight here, and let me caveat this by stating this is not my area of expertise. We have a large number of individuals at SAS whose focus is on genomics. I would encourage you to visit the site listed on this slide if you want to look about the hundreds and hundreds of different types of activities they've done in genomics research. This is just one example that came out last year that I think really demonstrates some of the interesting capabilities that can occur, especially in the genomics area. And this was an analysis to see if they could help predict the likelihood of death in sepsis cases. Now, it's about not just predicting the death, obviously, but looking at how to help improve the likelihood of survival by predicting based upon an individual's demographic, their clinical signs, their biomarkers, so they can help identify which type of people would likely end up dying of sepsis, so they could perhaps use a different approach or more interactions and interventions earlier on. So this was a study of nearly 1,200 suspected sepsis cases that came into the emergency room hospitals. And a whole bunch of clinical measures were collected right upon admission as well as 24 hours afterwards. And within this group, the people were broken up into three categories: the non-survivors, the survivors, and those that had systemic inflammatory respiratory syndrome. So a different but related type of condition that presents itself similarly. And they did a whole bunch of different types of analyses, which I'll walk through very briefly at a high level, to see if they could identify what were some of the predictors, what model could they use to help the clinics and help the hospitals know at the point of entry whether this was somebody who was likely to end up perhaps dying from sepsis later on. So as the four main parts, and this product that was used for this is called Jump Genomics. The idea here is the information that was being collected and the genomic information that was also integrated with this information. They went through basically four different types of analysis, mainly using visualization in most of these, to look first at discovery and prediction. And by this, I mean they're focusing on looking at the quality of the data to make sure that there's no bad data in here or anything that doesn't make any sense, as well as seeing if there's areas of interest that they might want to focus on as they do future analyses. The second step then is for pattern discovery. And here, oftentimes, they were focusing on doing correlation matrices to see if there were certain areas that higher precedence, a higher likelihood of correlation than other areas, so that they could focus in on those areas as well. The third area is ANOVA modeling, analysis variance modeling, looking at the survivors versus the non-survivors and the SIRS versus the sepsis cases, to see if they could see trends and patterns there as well. And finally, it came to clinical prediction. And here they looked at 7 different models, 3 of which had high predictive value to it, and the other 4 not so much. But the idea here is they were able to look at a variety of different approaches and identify what characteristics, what factors were likely to indicate that this person who is entering the hospital, entering the emergency room, was somebody who is at a higher risk of death, of sepsis, to help the hospitals and to help the providers take earlier preventive action. The last case I wanted to talk about is one that SAS did with the U.S. Food and Drug Agency, the FDA. And this was really an innovative one. This actually started just as a proof of concept that has now been officially adopted by the FDA. The FDA basically came to SAS with a challenge. There's a lot of information out there on the web and social media sites and research sites and all these places that perhaps would provide an indication that there's something out there that the FDA should be aware of and proactively monitoring before it becomes a large issue. So they wanted, the challenge was to look at text, unstructured data, oftentimes coming from many different, yet all publicly available social sites or media sites, and to bring this information together, to analyze it, and to see if they could identify potential trends, early indications that something was wrong, and to route that information quickly to those who could analyze it and to perhaps do some proactive preventive measures. So the process was to take a look at what we call documents. Basically, these are any type of form, any type of information that could be collected from a variety of different locations on the web or any other public site. And just to give you some numbers here, I believe there was close to 25,000 documents that we looked at spanning 7 years, all accessed, and you'll see on the next slide, from a bunch of different locations, with the idea that as you're going through these documents, you need to be able to identify which documents are related to the specific, in this case, it was a medical device. Which of these are referring to that medical device? And of course, that medical device could be referenced by a variety of different types of names. And then once you have that subset, you need to identify which of these relevant documents included some adverse event. And again, the terms that can be used for adverse events vary greatly depending on who's presenting it, how it's being referenced by a doctor or by a patient. And then once you have the list of those documents, those files that include not only the device but some reference to an adverse event, you need to be able to identify which of these are expected, in other words, which are consistent with some of the clinical trials and the research that was done as a known side effect, a known adverse event, versus those that are being reported as unusual or those that would not have been expected based on the testing, based on the product label. Then we need to also integrate all the other drugs, all the other conditions, all the other devices and substances that might also be referenced within that document, so you can figure out which of these are relevant to the particular device and which might be a byproduct of a different substance or different device, or perhaps by a combination of the two. And then to cross-reference all of those results with the public information that's out there, oftentimes stored by the government, such as PubMed or MAUDE. Now the last part, and this is something I'll talk about just a little bit in depth on the next slides, is that once we collected this information from the web, as I said before, if you didn't collect it, how can you trust it? So what we did is we added new analytics to identify the veracity of the information. Is the information that's stored in this document something that can be trusted, and if so, be included? Or is it something that you shouldn't include in your analysis because it would skew the results because this was information that was falsely put up there or just could not be true? And the goal of this entire process is to create this baseline of information so that in real time, in the future, you can constantly be trolling, constantly be searching and mining information that's posted online to look for in real time against a baseline to say, is there a new activity, a new event, a new indication out there that is of concern, and to raise it as early as possible to prevent people from dying from avoidable medical events. This slide here is just to give you a sense of the types of sites that we were looking at. This is mainly to demonstrate that we weren't looking at just social media sites. We're not just looking at information that people are posting because it's a site about the disease they had or a site about the device itself. Now, oftentimes this is where people are posting a lot of their information, but there's also research sites out there, government sites, as well as sites that are sponsored by official medical organizations, whether it's epilepsy in this case or the American Heart Association or some other cancer sites. So there are many different places that not only information can be gathered based upon what we call individual reported outcomes, but also research that people are putting up there online about the work that they've done and the results that they've found. So just to give you an overview of the flow, of the process of this case study, the first challenge was in how to access all these different types of sites, from social media, from unstructured data, free-form comments that might have been stored within, whether it's coming from research papers, whether it's coming from internal documents that the government might have had, as well as looking at scientific literature, news, the web, or other databases that might be out there. So you need to be able to have adapters to all these areas and then to bring it together into a common stored environment so that you can look at the information and identify which are the relevant documents. And that goes first through the process of what we call text analytics, which is one, identify what are the terms being used and to make those meaningful in the context. So there's different, as I said before, there's different ways, different words people will use based upon their location for the same condition or the same device. There's different languages. There's all these different approaches. So you need to have the dictionary, the taxonomy, the ontology all developed. And this is an ever organic type process. This is never done. And this is something that most companies that are dealing with text need to understand, which is you build this and it's a learning process. There'll always be exceptions. And once you identify a new term, a new way of referring to something, you add that to the process. The second is then once you've got the text, you need to understand the sentiment or the context. What are people saying? Just because they have the word pain and the name of your device or the drug does not mean that they had more pain or less pain, that it was improving or getting worse. So you need to understand what the context is. Are they happy with this? Are they receiving an unexpected side effect? Whatever it might be. So once you've defined which documents are relevant, what the meaning, what the context and sentiment is of it, the third thing we did was go through this veracity check. And we did this in 2 steps. The first step was really to find out who's talking. Obviously, especially on social media sites, you can put whoever's name you want up online. You can post anonymously, you can post under your real name, you can post under a pseudonym. So the first thing we did is use analytics to identify who are the most likely common authors, regardless of how they authored it or how they put their name to it. The second is once we've identified who that person is, we also looked at how frequently they were posting. And then we looked at the content of what they were posting. And we compared it to what was expected based upon the product label and what they were saying. And if what they were saying was completely impossible or implausible to occur, we were able to identify that this author was likely not trustworthy, and therefore his content, all the documents, and you could also tell because some of these people were posting the same thing over and over again, that they were just trying to get out some message that they had. But what this allowed us to do is to create a subset of just the likely truthful information and to separate out those that were expected of what people were saying with adverse events that were unexpected. And that allowed us to do this anomaly detection or signal detection. We were able to identify what of those events we should be forwarding on for a human to review. And to make this as easy as possible, we presented this information in a visual way with the idea here that people can see the patterns better, that people are more interested in having the information presented in a visual way where they can look at new what-if models in real time based upon just the results that they're looking at, yet still give them the opportunity to drill down to actually see, in this case, the specific comment that a human made or posted somewhere about that product. And as I said before, this is basically a way to be proactive in your management of information that's being put out there by real people every day about your product, about a condition, about an indication, so that in real time you can identify concerning trends earlier and to be proactive and preventive to address them. So in essence, at the end of the day, everybody asks me because I've talked about analytics in healthcare and life sciences for many years now, and big data is a confusing thing in the health and life science area because they're not really sure what it is and who's doing what. The thing I'd like to just finish off today by talking about the concept of big data is really about addressing a lot of the opportunities and challenges that are out there. You know, there are new types of data. We talked about the web and social media, but there's the devices, the wearable devices. Pretty soon, everything a person does and where they go and how much they walk and what they eat is going to be collected. And all this is streaming in real time. So the idea is, how do you collect and not only bring this data into your system, but aggregate it? And that's another trend that's occurring, is the aggregation of data within industries. SAS is sponsoring, or is hosting a site for life sciences companies right now, one around cancer and oncology, and one just about all clinical trial data. And we're providing massive areas for data to be brought together from multiple life science companies and to be accessed by the public, to be accessed by academia, to do research across a company's patient-level clinical trial data. So this is providing great new opportunities for people to aggregate information into larger data and to do new types of analysis. Obviously, there's the interest of what I call the convergence between industries, where healthcare, life science companies are buying healthcare data, and healthcare is looking more directly at what clinical trial research is done. Real-world data, how to actually take data from electronic medical records and help define the analysis that life science companies want to do. Building a trustworthy data set, again, going to the understanding of what information is being presented and trusting it, and providing visualization, as I mentioned before, oftentimes to the higher-ups. One of the benefits that we've seen from visualization that I've heard some senior level executives give is it allows them to quickly see what is the right question to ask. It might not provide the answers, but it certainly lets them know quicker by doing a bunch of different types of filtering and reviewing to see that's what I'm interested in, figure out why this is occurring. And finally, how to make this real time, how to do in-stream analysis. So as data is flowing, like we do for fraud at SAS, you can analyze a packet of information and tell quickly, is this something that I should be interested in, and is this something that I should be reacting to? So plenty of opportunities and plenty of insights to gain from big data. So with that, I'd like to thank you all for your time today. I will be here if anybody has any questions. Thank you very much. Have a great day.